can see my generation. There are no conflicts of interest to declare. As a way of introducing the program, there was a baseline study that was done for a project that we are running called Skills to Live in 2020, which indicated that young people are facing challenges in accessing quality SRH services due to factors such as lack of bus fare to actually go to the health facility, as well as negative attitudes of healthcare workers at the health facilities. And we also noted that transition to adulthood brings challenges in their livelihoods as well as the mental health, and there's need for assistance during this transition. So economic well-being enhances self-esteem, motivation, leading to a greater desire to maintain good health. And because of that, through the Ready Plus program, we incorporated skills training as well as SRH and HIV. So we're implementing a project called Ready. Ready stands for Resilient, Empowered Adolescents and Young People, which is a movement for the youth, by the youth, and working with adolescents and young people living with HIV. Currently, this program is being run in 5 countries, including Zimbabwe, and it's being led by a consortium of partners. Specifically, each partner has a technical expertise area. We start at individual level where we are working with the young people to become resilient and empowered, and Zvandiri is the lead technical partner on that. And then we go to create safe communities through dialogues with parents, through dialogues with faith leaders, through dialogues with community leaders. And the Regional Psychosocial Support Initiative, or REPSI, is the one that leads that. And then we come to making sure that our health facilities are adolescent-friendly, and PATA, whom you've heard, are also leading that. And then we're also working to make sure that these young people become advocates in their spaces, and they're working with the global network of young people living with HIV. But the last outcome speaks directly to this abstract, where we are saying we need to create resilient and empowered young people to have improved skills and better choices or options to secure their livelihoods. So we partnered with a vocational training center called Young Africa, and they provide different vocational training skills ranging from ICT, commercial subjects, as well as solar technology and others. So at the centers, we established a wellness center, a space where young people can actually go. And at the wellness center, it is manned by a youth-friendly trained nurse as well as peer providers within the spaces. The services that are provided include peer-to-peer support by the community adolescent treatment supporters, psychosocial care, SRH education, mental health, screening, clinical support, as well as referrals. And the data that I'm going to present is for the period January to June 2025, the cohort that was enrolled this year. The students that were enrolled at the Vocational Training Center are all recipients of care living with HIV, and they come from disadvantaged communities. At baseline, we do a mental health assessment to kind of see where they are before they start school, and we collect this data using Kobo Collect. We enrolled a total of 210 young people in January 2025, and 65% of these were females. 93 of the students were coming from the rural background. So at Young Africa, we've got both a hostel as well as the day students. And on average, when we looked at the 210, they had been in the Ready Plus program for a minimum of 4 years. What we found at baseline was that 75% of the young people were not at risk of common mental health problems. And when we rescreened them, the 25 that were at risk had drastically reduced to only 1% who were still at risk. So when we did the mental health screening in January, and then we found out those that were at risk, they were then supported by the nurse as well as the peer counselors. And the screening in June showed that we had addressed their problems. And then psychosocial support was being given. We had a total of 98 drop-in sessions at the wellness centers where issues of SRH as well as individual sessions were also being done. We had 7 students who had need of health services, and these were linked to the health facilities that are closer to the vocational centers. And in terms of service quality, we implement what is called the Ready Plus scorecard, where we ask the students to assess satisfaction with the services that are being given. And the one that was done showed that 86% of the students, of the young people that were accessing centers, were happy with the service that they got. We would want to go to 100, but then we make sure that the areas that are lacking, we address them. By June 2025, all of the students that had been linked, that had started the courses in January, were linked for industrial attachment for 6 months. They should be graduating by the end of this year. So what do we recommend? We recommend that programs should integrate, thank you so much, programs should integrate vocational training and psychosocial care. We need to support health-seeking behaviors and potential for informed choices for their health and their well-being. As the young students are transitioning into being adults and then into vocational training, we need to make sure that we continue to support their health-seeking behaviors. And then integrating vocational training as well as health and psychosocial support offers a holistic care for our young people and reduces their risk of having mental health problems. In conclusion, I would really want to acknowledge the Ready Plus team, Young Africa Zimbabwe, our community adolescent treatment supporters, as well as our government for this integration. So I still have 26 minutes. I'll say we are, and you'll say ready. We are? Ready. We are? Ready. Thank you so much. I still have 18 seconds.